Jason Palmer, one of the hosts of The Intelligence, The Economist's daily current affairs podcast. The Economist's award-winning shows make sense of what matters, from our special series on China's president to our weekly podcasts on business, technology, and American politics. Our journalists provide fair, in-depth reporting on the events shaping the world. To get the annual plan for less than $2.50 per month, search for Economist Podcasts Plus to start listening today.
Today on CityCast Pittsburgh, when you imagine someone having a heart attack, it can seem dramatic. Big symptoms, big response. But for women and people who've been pregnant, their symptoms can look so different that they might not know for sure that a cardiac event is even happening. February is American Heart Month, so we're checking in with a Pittsburgher to talk about what a heart attack really looks like and how to know when maybe it's time to get yourself checked out in advance by a doctor. It's Wednesday, February 7th. I'm Megan Harris, and here's what Pittsburgh's talking about. I'm with Dr. Katie Berlocker, the director of the heart program at Magee Women's Hospital. I am sure your days are wild. Thank you so much for making time for us.
Thanks for having me.
You know, looking at the statistics around heart health in America, it's kind of bleak. The CDC tells us that heart disease is the #1 killer in the U.S. And I am gathering from your resume that maybe you think women need a little extra help in this department.
Yeah.
Why? Why is it important to work specifically with these populations?
I do. You know, heart disease, like you said, is the #1 killer in America. But it specifically, and I think this is important to say, is that it's the #1 killer for both men and women. And, you know, in America, we do a really good job of advocating for breast cancer and many other diseases that men and women have. Honestly, though, in America, women's breast cancer gets a lot more attention than women's heart disease.
Do you think that it is worse for women in some ways?
I think we know that it is worse for women in some ways. Women actually at younger ages, despite the fact that it is less common to have heart disease diagnosed at younger ages, such as it is uncommon for a woman in her 30s to have a heart attack. That said, we know that when a woman in her 30s has a heart attack, she has worse morbidity and mortality for those next 10 to 15 years than men do, and increased rates of death than men do at that same age when they are diagnosed with heart attack.
You know, when I think of a heart attack, I think of the stereotype, the clutched chest, can't breathe, your face goes red.
Right.
I know intellectually that is not how it goes for everyone, but that seems like that's most of what we see portrayed. But it's almost always dudes. It's almost always guys in TV and movies that are going through these experiences.
You know, movies are really helpful. Clutching the chest, heaviness, tightness, an elephant sitting on the chest. Those are always actually really common. So the most common symptom for a heart attack for both men and women is chest pain, honestly. That said, women are more likely to have non-chest pain symptoms, such as neck pain, arm pain, ear pain, shortness of breath, nausea when they are exerting themselves. So those things are much more common in women than they are in men. That said, still, chest pain is the #1 thing that we pay attention to. You have to be real careful, though, with words because women don't always call it pain, right? They'll say,
I was about to say, like,
pain.
some of those things you're describing, like, could just be a really taxing day with a family member, you know?
Exactly.
So how do you know the difference?
Well, it's the importance of taking a really good history. Thank goodness I like to chat. And I love talking to my patients and getting them to say the same thing in 3 or 4 different ways so I understand exactly what they mean by, it wasn't pain, it was just the squeezing around my bra line. And I'll say, okay, when does that happen? And if they tell me, it only happens when I lay on my left-hand side and it goes away when I take a big deep breath, I say, okay, good news, that is most likely not your heart. That said, it feels like it's really tightening every time I walk up a second flight of stairs and it goes away after I rest for 3 minutes. Then I say, I'm going to need to know a little bit more. Tell me about what other physical activity. And do you ever get that band or other symptoms when you are doing other physical activity such as that?
Why are women like that? Why can't we just say we hurt?
Oh gosh, if I knew the answer.
I don't struggle with this personally. If I have a low grade headache, everyone in my household is aware.
Everybody knows. Yeah. I think it's a little bit of how you were raised, what your life experiences are, what you were taught. And when I was in undergrad, I majored in women's studies. And I think it's very interesting to look at how different genders and culture are brought up and how they are affected. And we all communicate slightly differently. And you can talk about stereotypes. And I think getting away from those stereotypes, even though you can see that there are patterns that are more common in women than there are in men, and more common in boys than there are in girls, right? And those lead to behaviors as adults, right? And, a lot of times still in our society, women are the ones who are in charge of the day-to-day tasks for children, for parents, for grandparents, for other
mental
family
load.
members. Yeah, exactly. And a lot of times because of that responsibility / burden, maybe it's a joy that you love, regardless of how you categorize it, it usually kind of requires you to put yourself second or third or fourth rather than first. And that can change the way that you decide to describe certain feelings.
And it can also just add stress over time. Even if you
Yeah,
love it, it's just still
exactly.
another thing that weighs on you, even in the back of your mind while you're doing other things for years.
Yep, you would choose it time and time again, but it does have a weight,
Yeah.
right? It does have a weight, and carrying that weight over time, gets you used to the weight. So sometimes you don't even realize it because it's been going on for so long. But also, it oftentimes allows you to kind of ignore or put it off.
Are there life things that can make it worse? Like I'm thinking about like diet and exercise, of course,
Yeah,
though I'm sure genetics play an enormous
right.
role in whether that's helpful for you.
Right. Right. You're exactly right. There's a lot of things. And I usually lump these into things that patients can do that they are in control of, such as some of what you talked about, diet, exercise, other things. And then things that we cannot control, such as our genetics, and other things that women have in their lifeline, in their life in general, that men do not have, such as pregnancy, right? Most women, if they decide to get pregnant, may have some sort of complication related to future cardiovascular disease, such as high blood pressure or diabetes. And even worse than high blood pressure would be things like preeclampsia. And we know that these things, which obviously don't occur in male lives, increase the risk of future cardiovascular disease. Now, the big question is how and why that is, right? And we think that it is actually linked at a very, very kind of small vascular level that increases that risk later on in life. And we're just really getting a kind of signal early on in life during a stressful period such as pregnancy. But there's a lot of other things.
I'm impressed that there's any amount of knowledge known about that. So much of my experience being pregnant was being told, oh, we don't know. The science doesn't say
Yeah.
because we can't study pregnant bodies.
Yeah. Well, oh gosh. And if you ask me the most frustrating things in medical science research, it is that women didn't get studied for a very long time. We are now starting to increase the amount of women included in studies, and even grants now are given much more to scientists that are doing both men and women, including all sexes, in a scientific research study. That said, we still are really fearful to study women, right? During their pregnant periods, right? And honestly, it extends even to women who can get pregnant. So the childbearing years are really hard for us to get, safety protocols. And I think, it's appropriate. It's totally appropriate for us to be cautious about this stage in life, but it has led to a large black box, as you recognize, that the answer is oftentimes we don't know. We don't know, which we can do better.
And is very frustrating as a patient to hear, I'm sure, also as a physician.
Right, exactly. And we're left with really being experts, which is fun as a cardiologist who sees a lot of pregnant patients. It is terrific to be able to say, I really deeply understand the physiology and the pathophysiology of both pregnancy and cardiac disease, and then can combine those two to use my expertise to predict something. But unlike all of my other patients who are not pregnant, I don't have data, thousands, millions of patients who have been studied who can say, when you have this, it can lead to this percent of time, right? In pregnancy, we don't have that yet. In a lot of patients, we do have it for patients who have preeclampsia, for patients who have gestational diabetes. And we're starting to have more science surrounding in vitro fertilization and other conception issues for patients so that we can better understand what it is that they're at risk for in the future.
Shipping can make or break a sale, so optimize how you ship your orders with ShipStation. They make it easy to automate and manage orders no matter how big your business grows. And they might even be able to help reduce shipping and warehouse costs. So optimize and keep up your momentum for growth with ShipStation. Sign up for your free 60-day trial now at ShipStation.com and use the code POD. That's ShipStation.com with the code POD.
There's a big difference between talking and reporting, especially right now with a fire hose worth of news coming your way. You know what helps? Having reporters in the field. I'm Brad Milkey from ABC News, and that's what we've got on ABC's daily podcast, Start Here. Every morning, Start Here takes you across the country and around the world for a quick, smart look at the stories that matter. It's fast, it's straightforward, and sometimes, gasp, news can even be fun. So let's meet up tomorrow morning. Listen to Start Here wherever you get your podcasts.
So just thinking about these risk factors for heart disease, is there like an age that you recommend that people should start making themselves aware of these things?
Well, I always say, first and foremost, before there's not a specific check the box age. I will say this, if you have any symptom that comes with exertion and gets better with rest, even if my earlobe gets tight and sore during that, those are things that you should see regardless of you're 25 or 95, you should see somebody for exertional symptoms for sure. But the other time that I think is really important after you're done having babies is the menopausal period. So a lot of times menopause, which is the loss of estrogen in our bodies, and estrogen actually is a really lovely hormone for our vasculature. So it really helps our vessels react appropriately, to dilate appropriately, and respond to a lot of other agents in the body. When we lose the estrogen, we not only have a change in some of our cholesterol, but we also have a change in some of the way that our vasculature works. For some people, not for everybody. So I think it's always appropriate for everybody to go in and see at least your primary care physician to see if you have risk factors.
Yeah, I mean, risk factors, could family history play a part in that too? I'm over here mentally counting. I'm in my 30s. I have a child. I have two grandparents with strokes and one that had a pacemaker. So am I iffy?
Sure. A little bit. So family history really catches my attention. Certainly if you have grandparents, okay, parents, sure. But the big thing that I think about is, does anybody in your family, did they have an early heart attack? And for that, I mean men earlier than 55 and women earlier than about 55, 60. You get a little bit more grace as a woman just because you have the protection of estrogen until menopause. But, the other numbers that I think about are really important for everybody to know, regardless of your age or, honestly, sex, even for that matter, are your blood pressure. So your top number and your bottom number. I would love for everybody to know what your fasting blood sugar is. Okay, so that's a marker of diabetes.
I feel like a lot of people know blood pressure. Very few people know blood sugar.
Blood sugar, fasting finger prick for that blood sugar. And then the other numbers that I ask people to know would be their cholesterol numbers. So the one cholesterol number that I really look at is something called your LDL, which is your lousy or your bad cholesterol. And I say LDL should be low and it's always lousy. Okay. So we want that LDL as low as possible.
And it's the HDL that it can be high.
Yeah,
is that
look
right?
At you.
Okay.
Hey, Megan,
I'm
fancy.
pulling it back from sixth grade.
Yeah, HDL is your good or happy cholesterol, and we want that to be high. Okay, so your H's and your L's. LDL is lousy, you want it to be low. HDL is happy, and you want it to be high. And then one other thing that I put in the mix of things, and I know that there are a lot of feelings out there to this number nowadays, but the BMI, we know that elevated BMIs or body mass index is related to increased cardiovascular risk in the future, whether it's through hypertension, development of diabetes, or a sedentary life. And so we really like people to achieve as low of a kind of healthy BMI as they possibly can. I don't need everybody to be perfect, but we do know that that is another risk factor. And then the biggest one, I was just talking to a patient about this today, no smoking. If you are having any, and that includes vaping. So smoking and vaping really does increase your risk of future cardiovascular disease.
Yeah, I can imagine the conversations about BMI. It is an imperfect number, but
It is.
I imagine it's like just one more thing that you check in on.
Yeah, it is. Good to know.
Well, we are definitely glad that you are doing this work here in Pittsburgh at UPMC. Are your fellow doctors doing it too, or even medical students? Like, are people being trained on kind of how all this is evolving over time and that maybe women do need like this smidge of extra attention?
Yeah, we do. We do. Not to be attention hogs, but I think we deserve the same amount of attention as others. And with that said, there are many other vulnerable populations who have not gotten the attention that they deserve, such as people of color, such as those who are in the LGBTQIA space. We know that those patients who are considered minorities, but honestly, women are not minorities, right? We make up 50% or maybe 51%, depending on what statistic you're looking at. So it's just a vulnerable population that has not been studied as well as others. And I think bringing attention to that will really kind of behoove us with regards to teaching patients about the things that they need to be aware of and giving them the power to really take control of their life. We know that 50% or more of the disease from a cardiovascular standpoint in America can actually be stopped with good behaviors, meaning diet, exercise, decreasing stress, increasing sleep. Like this actually is like doable. Like we can prevent this. It's really just us getting the information into the hands of everyone out there.
And do you see a role for maybe family members to participate in some of these conversations as well?
Absolutely. Yeah, absolutely. I think, provided it's a friendly conversation and supportive, not nagging, right?
Like relationships are good, all of that.
Yeah, nagging can go actually a little bit of ways with a lot of my patients and their partners that they bring in. But I think, it's really important to have good behaviors with the people that you're living with. So it's not like you're going to cook your own dinner and then everybody else gets the unhealthy cardiac meal, or you're going to go for a walk while everybody else sits and watches TV for 5 hours, right? Those are the things that you can do together that your family members or your friends can celebrate the health of each other together and really get into those good habits as a group.
Well, and before we let you go, I hear that February is also American Heart Month.
It is.
Do you do anything personally to mark the occasion?
Oh, we do. Yeah, well, I do a ton. I actually have a lot of events and other things that I get to talk at, which is really exciting. Talking about what the risk factors for everybody are. I am not shy about talking to patients' family members when they come in to make sure that they too know what their blood pressure are and their blood sugar and all of their cholesterol numbers are as well.
Yeah, we'll have information on any of the screening events that we can find in our show notes and in our Hey Pittsburgh newsletter. Dr. Berlacher, thank you so much for talking to us today.
Thanks so much for having me, Megan. It was a joy.
That's all for today here on CityCast Pittsburgh. If you're liking the show, please tell someone, rate us, leave us a nice review, and subscribe to our Hey Pittsburgh newsletter. If you want more information about heart health, but also how to keep your heart happy, we've got so much in there, especially some recommendations for Valentine's Day. Please check it out. It's all online, pittsburgh.citycast.fm. We'll be back tomorrow morning with more news from around the city. Talk to you soon.
I would put red gloves on all the NFL athletes and basketball players and, all the women's athletes out there, too, because it really does get the word out.